Does your skin tell secrets about what's happening inside your body? Most people think itching is just a minor annoyance, something you scratch and forget about. But after 70, persistent itching in certain areas can be your body's urgent way of warning you about serious internal problems that need immediate attention. The location of that itch matters far more than you might imagine, and recognizing these patterns could literally add years to your life. Today, we're going to explore 5 specific areas where persistent itching after age 70 should never be ignored. These aren't just uncomfortable nuisances. They're potential early warning signs of conditions affecting your heart, liver, kidneys, circulation, and immune system. We'll share real stories from people who learned these lessons, sometimes the hard way, and give you clear guidance on what to watch for and when to seek help. Understanding these signals empowers you to take action before small problems become life-threatening crises. Let's start with the first critical location: persistent itching on your lower legs. Many seniors experience itchy shins, calves, or ankles and immediately assume it's just dry skin from aging or cold weather. They apply lotion and move on. But chronic itching in these areas, especially when it doesn't respond to moisturizers, can indicate serious vascular problems, particularly peripheral artery disease, known as PAD. As we age, the arteries and veins in our legs can narrow or become blocked, reducing blood flow to the skin and tissues. When your legs aren't getting adequate circulation, the skin becomes dry, thin, and intensely itchy. This isn't surface-level dryness that lotion can fix. It's your body signaling that blood isn't reaching where it needs to go. If you ignore this warning, the consequences can be severe, including chronic ulcers that won't heal, serious infections, and in extreme cases, amputations. Watch for these additional warning signs alongside the itching. Does your leg skin look unusually shiny or discolored? Do you have swelling that doesn't go away? Do small cuts or scratches take far longer to heal than they used to? Does the itching get significantly worse at night when you're lying down? These are all red flags pointing to circulation problems. Consider Richard's story. In his early 80s, Richard noticed his lower legs itched constantly, especially at night. He thought it was just part of getting older and kept using stronger lotions. But the itching persisted, and eventually his skin started looking different, thin and shiny with a slightly purple tint. His daughter insisted he see a doctor, and tests revealed peripheral artery disease. The blocked arteries weren't just causing itching, they were putting Richard at risk for serious complications. With treatment including medication, lifestyle changes, and careful monitoring, Richard's condition was managed successfully, but he wished he'd recognized the warning signs months earlier. The key insight here is straightforward. Persistent leg itching, especially below the knee, is often an early sign of poor circulation that many people ignore until it's too late. If your legs itch chronically and moisturizer doesn't help, schedule a vascular checkup immediately. Early detection of circulation problems can prevent devastating outcomes. Now let's move to the second critical area: an itchy scalp that won't quit. After 70, many people experience some scalp dryness or occasional dandruff, but chronic, relentless scalp itching is different and potentially serious. This kind of persistent itching can signal autoimmune diseases, where your immune system mistakenly attacks your own body tissues. Pay attention to these specific symptoms. Is your scalp constantly itchy, no matter what shampoo you use? Do you have persistent flakes or scaling that looks like dandruff but doesn't respond to dandruff treatments? Are there sores on your scalp that don't heal properly? Are you losing hair in clumps rather than gradually? These signs suggest something more serious than normal aging or dry skin. Beyond autoimmune conditions, chronic scalp itching can also be an early sign of skin cancer, particularly if you notice changes in moles or skin texture. It can also indicate liver or kidney problems, as these organs filter toxins from your blood, and when they struggle, those toxins can affect your skin and cause intense itching. Janet's experience illustrates why this matters. At 78, Janet endured relentless scalp itching for months. She tried every over-the-counter treatment available. Her hair started falling out in patches, and she developed sores that wouldn't heal. Finally, her daughter convinced her to see a dermatologist who ran comprehensive tests. Janet was diagnosed with an autoimmune disease that was beginning to affect multiple systems in her body. Because she sought help when she did, doctors caught it before it caused permanent organ damage. Treatment helped control her symptoms and protect her overall health. The lesson is clear. A scalp itch that persists, especially when accompanied by visible skin changes or hair loss, can indicate serious immune system or systemic issues. Don't dismiss it as simple dandruff or aging. See a dermatologist who can properly evaluate what's happening and run the necessary tests. Our third dangerous itching location is around your midsection or abdomen. Unexplained itching on your belly, around your waistline, or on your lower back might seem random and harmless, but it can be an early warning sign of liver disease. This is particularly important because liver problems often develop silently without obvious symptoms until they're quite advanced. Your liver filters toxins from your bloodstream. When it struggles to do this job effectively, whether from fatty liver disease, hepatitis, cirrhosis, or even liver cancer, bile salts and other waste products accumulate in your blood. These substances cause intense itching, often worst at night when you're trying to sleep. The itching from liver problems is distinctive. It's deep and internal feeling, not something on the skin's surface, and scratching provides little relief. Watch for these additional liver-related signs. Is your skin or the whites of your eyes taking on a yellowish tint, which doctors call jaundice? Do you have unexplained swelling, particularly in your abdomen or ankles? Is your urine darker than normal? These symptoms, combined with persistent itching around your midsection, demand immediate medical attention. Walter's story demonstrates the importance of recognizing this pattern. At 82, Walter experienced persistent itching around his waistline and lower abdomen for several weeks. He thought maybe his clothes were irritating his skin or he was having an allergic reaction to something. But the itching intensified, especially at night, making sleep difficult. His wife noticed his skin looked slightly yellow and insisted he see their doctor. Blood tests revealed early liver disease. Because Walter sought help when he did, doctors implemented treatment to control the condition and prevent further damage. Walter learned that his body had been sending him urgent signals through that persistent itch. The key takeaway is this: persistent abdominal itching, especially when it's worse at night and accompanied by other subtle symptoms, may be your liver's way of signaling that it's struggling. Don't wait for more obvious symptoms to develop. Get your liver function tested immediately. Let's move to the fourth critical location: itchy palms and soles of your feet. This is an unusual place to experience itching, and that unusualness is exactly why it's so significant. Persistent itching on your palms and the bottoms of your feet often points to kidney or gallbladder problems in seniors, and it can also be an early warning sign of certain cancers, including pancreatic cancer. The skin on your palms and soles is thick and packed with nerve endings, making these areas particularly sensitive to chemical imbalances in your blood. As kidney function naturally declines with age, toxins can build up in your bloodstream, and one of the ways your body signals this problem is through severe itching in these areas, often without any visible rash or skin changes. Thomas's experience shows how serious this can be. At 79, Thomas endured severe itching on the soles of his feet that kept him awake at night. He tried every cream and powder available, thinking it was athlete's foot or some fungal infection, but nothing helped. The itching was maddening, and he found himself constantly removing his shoes to scratch. Finally, he mentioned it to his doctor during a routine visit. Tests revealed that Thomas's kidneys were failing. He needed immediate specialist care to manage the condition and prevent total kidney failure. Thomas was shocked that such a seemingly minor symptom indicated such a serious problem. Watch for these warning signs alongside palm or sole itching. Does the itching worsen significantly at night? Do you have swelling in your hands or feet? Have you noticed changes in your skin color or texture in these areas? Do you feel more tired than usual or notice changes in your urination patterns? These combinations of symptoms require urgent evaluation. The critical insight here is that persistent itching on your palms or the soles of your feet is rarely benign after 70. It should prompt immediate investigation for kidney function, gallbladder health, and in some cases, screening for internal malignancies. Don't dismiss this symptom as minor. It's your body's way of telling you something important needs attention. Finally, let's discuss the fifth dangerous location: unexplained itching around your chest and back. Persistent itching on your chest or upper back can indicate problems with your heart or lungs. This surprises many people because they don't associate itching with cardiovascular or respiratory issues. But the nerve connections in these areas can reflect underlying problems like poor oxygenation or silent inflammation affecting these vital organs. Some seniors report experiencing persistent itching in these areas weeks or even months before experiencing heart attacks or being diagnosed with serious lung conditions. While the itching could also result from allergies or nerve problems, after 70, any unexplained persistent itching in these areas demands medical evaluation. The stakes are simply too high to ignore. Evelyn's story illustrates this perfectly. At 80, Evelyn experienced recurring itching on her upper back between her shoulder blades. It bothered her for months, but she couldn't figure out what was causing it. She changed her laundry detergent, bought new clothes, and tried various creams, but nothing helped. During a routine checkup, she mentioned it almost as an afterthought. Her doctor, taking it seriously, ordered tests that revealed a silent heart condition. Evelyn had no chest pain, no shortness of breath, no obvious symptoms. That persistent itch was her body's only warning signal. Early treatment prevented what could have been a catastrophic cardiac event. Additional symptoms to monitor alongside chest or back itching include any shortness of breath, even mild, feelings of pressure or discomfort in your chest, and unusual fatigue that doesn't improve with rest. If you experience persistent itching in these areas, along with any of these other symptoms, seek medical evaluation immediately. Don't wait to see if it gets worse. The key understanding is that chest and back itching may be the first subtle sign of cardiovascular or pulmonary disease. Your body often sends quiet warnings before sending loud ones. Listen to those whispers before they become screams. So here's what we've learned today. 5 specific locations where persistent itching after 70 should never be dismissed as just dry skin or normal aging. Lower legs pointing to circulation problems. Scalp indicating possible autoimmune disease or organ dysfunction. Midsection suggesting liver issues. Palms and soles warning of kidney or gallbladder problems. Chest and back potentially signaling heart or lung conditions. Your skin is your body's largest organ, and it often reflects what's happening internally, especially as you age. A nagging itch that won't go away, particularly in these 5 critical areas, may be one of the earliest and most important warning signs your body can give you about serious illness developing inside. The beautiful truth is that recognizing these warnings early gives you power. Power to seek medical attention before conditions become critical. Power to start treatment when it's most effective. Power to potentially add years to your life and maintain your quality of living. But that power only works if you take these symptoms seriously and act on them. Starting today, pay attention to persistent itching, especially in the areas we've discussed. Don't dismiss it. Don't assume it's nothing. Don't wait to see if it gets better on its own. If you've been experiencing chronic itching in any of these locations, schedule an appointment with your doctor this week. Describe exactly where you itch, how long it's been happening, whether it's worse at certain times, and what other symptoms you've noticed, even if they seem unrelated. Be your own health advocate. Doctors see dozens of patients every day, and they rely on you to give them complete information. Don't minimize your symptoms or leave anything out because you're worried about seeming like you're complaining. These itches could be critical clues that lead to early diagnosis and successful treatment of serious conditions. Remember the stories we shared today. Richard's legs, Janet's scalp, Walter's abdomen, Thomas's feet, and Evelyn's back. Each of these people initially dismissed their itching as minor. Each eventually discovered it was their body's way of warning them about something serious. Each wished they'd acted sooner, but was grateful they acted when they did. If this information has opened your eyes to symptoms you've been ignoring, I want to hear about it. Leave a comment telling me which warning sign resonated most with you or whether you've experienced any of these symptoms yourself. Share this video with friends and family who need to hear this message. And subscribe to the channel so you don't miss future health insights that could make a real difference in your life or the lives of people you care about. Your health matters. Your symptoms matter. That persistent itch that's been bothering you matters. Trust your body when it's trying to tell you something. Seek the medical care you deserve and give yourself the best possible chance at a long, healthy, independent life. Here's to listening to your body's whispers before they become shouts, and to many more years of vibrant, healthy living ahead.